Thank you very much for coming. I'm greeting you here in Hungary, in Budapest, and I hope that you feel very well here and can enjoy our hospitality. Thank you so much for Professor Kaschler that invited me to this occasion, this meeting. And at the beginning, I'd like to introduce myself a little bit. I'm the Chief Medical Officer of Hungary. Last year, after COVID-19 pandemic, there was a governmental decision that the formal institute who were responsible for Hungarian people's health was merged together under one umbrella. So the National Center for Public Health and Pharmacy is a quite big, huge institute now because it's responsible for a lot of different territories, different fields of correlated with human health. We had a small talk before the meeting. We haven't a strong bilateral connection today, but under the organizing of the WHO, we met with your colleagues as well. So I hope that today is a very good possibility to come closer together, and I think we can exchange our experience. We can learn from you, and you can learn from us. I hope so. When we see this collaboration in this view, there is a saying in Hungary, sometimes 1 + 1 can be 3, not just 2. And there is a very good occasion for me to show that we had some collaboration during the COVID-19. We received a different type of vaccines from West and from East as well, because I think that the vaccination isn't a political issue, it's just a professional issue. I tried to show you some results of our institute, what we had made during the COVID-19 and the program about vaccination during the COVID-19 with 6 types of different vaccines. As I know, Hungary was the only one country who used 6 types of vaccines in Europe. Yes. So we have 4 reviewed about this topic, and we called HUNVI studies. Hungarian COVID epidemics run in 6 significant waves, as you can see in this slide. You can see the different the different variant type of the virus as well here. And when we see at the end of this slide, you can see that after the complete immunization of large part of the population, several insignificant waves have been observed with limited number of illness, and only a small percent of severe cases and death we can see. This is our first study, the HUNVI-1. The effectiveness of COVID vaccines has been studied and results published in 4 consecutive papers, as I have mentioned. And I'm very proud on it that it was published in ranked journals. The first paper compared the effectiveness of 5 different vaccines that were used in Hungary. I have mentioned 6 types, but one of them is for very small amount, and so we can study 5 types of different vaccines. This picture is a little bit complicated, but 5 different vaccines were applied since no single company was able to deliver the necessary amount. We ask for vaccines everywhere, from the east and from west as well, because we haven't enough amount of different vaccines. The campaign started on 15 December 2020. It was a Christmas present for us. The study period has been adjusted to the start of vaccination with the given type, as you can see here. And the differences in the age distribution of the different vaccinated groups were considered.
Once more again.
Yes, we share in different age group, as we could see the effectiveness of vaccines in different age groups. We use different vaccines, not on the same population, because we begin the vaccination at elderly people and the healthcare workers. The effectiveness was studied in terms of infection incidence as well as the mortality. These two things was the most outcomes. You can see here the blue column. This is a control group who wasn't vaccinated, unvaccinated people. As you can see, the number of infection was dramatically lower. The red column one at vaccinated people, of course, to the unvaccinated people. You can see that. We compared always the effectiveness of vaccines to the unvaccinated people, but despite there, you can see the different vaccine types, our results. The results in terms of COVID caused death, here you can hear the death cases, were even better in all ages and at vaccination type. In order to obtain comparable data, the age-adjusted effectiveness, the yellow column one, were calculated for each vaccination type. However, the goal was not to rank the different vaccine types in terms of effectiveness. As I mentioned, we compared to the unvaccinated group, but to demonstrate all of them was highly effective. You can see here the infection cases, but when you see the mortality cases, is much better than infection cases. So we can protect people from death from several illnesses. This was our first work. This is the second one, complete immunization. It means 2 doses of a special vaccine when in about 3 months it was all the same situation at all kind of different vaccines. So it was very clear that we have to booster vaccine. After 3 or 4 months we need it, and we investigated the effectiveness of booster vaccination in this case. But this time we were at the period of Delta variant and the Omicron variant. It is a new situation again. Yes, you can see at the red line the death cases, and at the blue line the infection cases. What we have found, you can see here the COVID-19 mortality risk. So it means you can see the dotted line in red. It means the relative risk. So it means that you don't do anything it is the same situation. It would be the same situation when at the vaccinated and the non-vaccinated, unvaccinated people. But you can see that the black point show that it was very, very useful and minimize the death cases at the vaccinated people. So the booster vaccination was very, very useful, mainly at elderly people. These tables seems to be a little bit complicated, but you can see the similar situation that I have mentioned. I'd like to make a little bit easier. You can see the primary immunized people, one booster vaccination, and the third one, the double one. Yes. This is our third review, and we try to see not just during the Delta wave, not just the effectiveness of vaccines, but the waning of immunity has been studied. At that time, various fast self-tests became available. So some people made a self-test at home. And despite that, we couldn't register all infection cases. So you can see just the registered cases. But even you can see very well that the days after the primary vaccination and the booster vaccination and the different type of booster vaccines. You can see every of them was useful, but we can see that Sinopharm booster was a bit less effective than other booster types. This is very similar to the other slide, because we have seen the death cases were very low, fortunately. So we have to see the severeness of disease. It means the hospitalization cases. But you can see every type of vaccines will be higher than 50% of protection, what is recommended by the WHO. And at last, but not least, our fourth study, we try to collect data about the patient who suffer from any chronic diseases. This period was covered during the Delta wave, and we have investigated the diabetic patient with two type, diabetic type 2. Our results can you see there. Most of diabetic elderly patients became vaccinated. You can see there that the unvaccinated population in this cohort was less than 14%. We had the best results from the Pfizer vaccines, but then also significant proportion, more than 25% applied for Sinopharm as well. You can see here the healthy people without any diabetic problem. It means the blue color, red with the diabetic. With diabetic. And that's why I like this figure even more, with two exceptions. With two exceptions, the red line, the mortality of vaccinated diabetic patients was less than unvaccinated healthy population. Thank you so much. It was a very small summarize what we have done. I think it is very, very good that we had an evidence of our work, because it means it is a retrospective work, but it is a very, very good. It was very, very hard time, and we were enough brave to solve the problem and use the different kind of vaccines. And it is a very, very good sense for me and for my colleague. Thank you.